Okay, hi everybody. My name is Casey Labonte, and I am the Food as Medicine Program Coordinator with Iowa State University's Extension and Outreach. Welcome to our panel discussion on food as medicine with a focus on food and insurance access. Today, we will explore how access to food intersects with healthcare coverage and its impact on lived experiences and holistic health outcomes. Let's start with some introductions. Jen, why don't you go first? I'm going to set the timer. So each of you has 2 minutes each.
Well, thanks, Casey, and thanks to all the panelists for this discussion. I'm really looking forward to it. My name is, Casey said, is Jennifer Reynolds, and I'm one of the co-executive directors of Nourish. So we're a Canadian community of practice, really exploring how food and health intersect, looking to change patient meals and the centering of food for health in the Canadian healthcare system, and really trying to have an impact on climate, health equity, and community well-being. So for too long, I think food has been siloed from health, and that's really the focus of our work. So my background is in community food security and food systems, and a lot of that always brought up this issue and challenge of how health is disconnected from food. The Canadian context is quite different from the US, so I'll be bringing those elements into the conversation with everyone. And yeah, I don't need to use the whole time, right, Casey? Okay, perfect.
All right, Val, if you could go next.
Good morning. My name is Valerie Segrest, and I am a member of the Muckleshoot tribe located just south of Seattle, Washington. My background is in nutrition, and I guess when I was going to get my degree in nutrition, I really didn't want to hold practice in a clinical setting where I was prescribing to my people a diet that I knew that they had challenges accessing in the first place. And so I chose to focus my practice in community nutrition and launched the Muckleshoot Food Sovereignty Project, which looks like a collective body of research where we are constantly asking tribal community members how they what interest they have in accessing traditional foods and what they would need to be able to access those foods. And so that has looked like developing curriculum over the years, developing policies, identifying food resource areas, places where food can be more cultivated, and then also just writing recipe books and doing fun things like that. So right now I'm the co-owner and founder of Tehama Peak Solutions, which is a Native women-owned firm that really specializes in telling culturally appropriate and relevant stories around food systems work in tribal communities across the country.
Great, thank you. And Lindy.
Hello, you were both hard acts to follow. So I'm Lindy Buckingham Shutt, and I'm an assistant professor at Iowa State University in food science and human nutrition. And I also have a dual appointment with Iowa State Extension Outreach as a human scientist. And my role, really, as I see it in the food system, is to continue to be a voice at the part of the food system where people are consuming food, where people are we're making sure people have access to affordable food that is nutritious, nourishes our bodies. And I really have engaged in this work. Found it's really important to engage in this work through working with programs that administer nutrition incentives, specifically working with administrators of the Double Up Food Bucks program, which is the program here in Iowa that doubles up is a nutrition incentive program here in Iowa that helps people who are using food assistance, the SNAP program, formerly known as food stamps, have access to healthy food, specifically reducing the barrier of cost for produce, as well as working with produce prescription programs. So very similar concept of increasing access to food by reducing the barrier of cost, and really finding innovative ways to reduce other barriers, not only cost, but transportation, access in terms of nutrition education, those types of things. So that's where I'm coming from in this conversation. And I do live in Iowa, which is a heavily agriculture focused state. And so I'll probably bring a little bit of that aspect into this conversation as well.
Great. Thank you all for the introductions. We're going to start with our first question, which I'll put in the chat for you to reference. First question is, can you describe what food as medicine means to you? And we've asked you all to come in with some images. So if you have images to share, I've enabled the screen sharing, so you should be able to do that while you tell your story of what food as medicine means to you. And Val, you will go first.
Right. Food as medicine for me is what we call the native nutrition principles. We also have a poster called Feed 7 Generations, which is really a collective of sort of cultural values that have come out of discussions that I've held with native food knowledge keepers, other dietitians, administrators, leaders, fishers, harvesters, all the folks. There just are these commonalities that are as applicable today as they were generations ago. And, it really, also for me, I see that we have a real imbalance when we have these really calorie-rich diets and not very nutrient-dense diets. And what we're seeing is this rise in just micronutrient malnourishment, that we're just not getting enough vitamins and minerals. And nutritionists are really good at vilifying things like carbs and fats and proteins and all those things. But I'm trying to cheer on the increased access and increased consumption of vitamins and minerals. And in order to do that, we have to prioritize healthy lands and waters. That means these micronutrients are developed out of plant bodies that we, as basic humans, cannot develop ourselves. We require them in order to exist, which means we need plants and our foods to be super healthy. They need access to healthy soil to be able to draw up those minerals, and they need access to healthy air and sunshine to be able to develop vitamins. And so I'm incredibly interested in the parts of malnutrition that have to do with vitamins and minerals. And that's because several of the lead causes of mortality in the communities that I serve are directly correlated with micronutrient deficiencies, like magnesium, for example, which the symptoms look very similar to folks who may be, diagnosed as pre-diabetic or need that extra boost. When I'm working with someone who has an issue with balancing insulin, for example, a like magnesium rich tea or a magnesium potassium rich tea will actually help them come back to balance. And it just has always verified for me that those minerals are something that we're really hungry for. And our Coast Salish ancestors would actually be getting 3 times more calcium and magnesium in one, dish of food than what the USDA dietary guidelines are set at. And so there are some issues there around what is actually, where those numbers come from and what is actually important. Is that like telling me that I'm out of time?
Yeah, that was the timer.
That's hilarious. So, do you want me to quit screen?
Oh, you can finish up the slide that you're on if you want.
I have one more slide that you should.
Yeah, no worries.
Oh, 3 more slides. Okay. So anyways, I'm off my nutrition soapbox, but the remedy is always, if you Google in the USDA database, what the actual magnesium rich foods are, it's always a native food. It's always a food that is sourced from North America. Salmon, beans, oysters, chia seeds, huckleberries or wild blueberries, maple syrup, like all these things are rich in micronutrients. So there's that, but that maybe we move away. I think that there's like the science piece of it, the reductionist view of it serves a purpose, but that we also have this animation of food culture that could happen. And that might help people feel a little bit more inspired when they're developing what they want to put on their plates. And that looks like an ancestral diet for me looks like living with the seasons. It looks like diversifying your diet, that you're not just consuming the typical 12 to 20 foods in the standard American diet, but you're expanding to the potential 300,000 different types of plant foods alone that us humans can consume. That you're prioritizing eating traditional foods and whole foods, and maybe gathering more wild foods, or sometimes just prioritizing eating more organic food if possible. Cooking and eating with good intention. I think that we forget that a lot, that we're just eating from one thing to the next and not really stopping to rest and digest, and that is part of like real true deep nourishment. And then also giving back to the land, that there's this, acknowledgement that we are a part of our food system and we're not separate from it. We don't have dominion over it, but that our health and the health of the food system they mirror one another. So that is my nutrition soapbox on what and why food is medicine for me.
Beautiful. Thank you. Jen, you are up next whenever you're ready.
I was just basking. I was just like, that's so amazing. I have so many questions for you. I just want to hear more about that approach. It's so cool. It connects a little bit to Nourish's work. I'll kind of use that as my starting point. Let me just see if I'll share my screen. So I think I see food as medicine, and this very much like a system, the food and healthcare system. So this is what we call our food for health levers. So the outer circles, there's a lot of text here, but they're really about how the experience of an individual or community in health, like these are the elements and opportunities that we see about integrating food into every aspect of it. So we have practicing food as medicine, because I think that's actually very divorced from the the normal or average experience a person has in our current healthcare system. Food, no one asks about food, whether you have access to food, diet, it's well known. I think, it's not part of, apart from the dietetic or nutrition practice, it's not part of how anybody else in a healthcare professional even encounters or thinks about diet, or even more interestingly, I think about the food system. And that last comment you said, Valerie, I think is so critical. I think in this moment that we're in, facing the climate emergency, that our health and the health of the planet are, even more explicitly than ever connected, and the need that we have to change our food system is even more of an imperative. So food as medicine, I think, comes up for me as well around the access piece. I think, we've known for decades in a Western society that the social determinants of health are more impactful about what someone's health is than the healthcare services that they receive. But in the Canadian context, it just goes, it falls between the cracks, between government silos, between institutional silos. So nobody is responsible for ending hunger, having a population health based on a healthy diet. And then there are the equally important elements in the Canadian, North American context of decolonizing food, and understanding, as you were saying, Valerie, a lot of these things that are so essential of people's connection to, or Indigenous communities' connections to the land and their history, and the many ways that food is our medicine is understood and practiced. And I think there's a lot to do to rebuild those practices and enable that leadership from communities to be expressing how they understand health in a more multifaceted way than a typical Western science approach would frame it. The other piece, I guess, just to bring it in is, as a program area of Nourish, is called Food is Our Medicine. And I think some of the themes that we, in the development of this, it's a learning journey and a resource bundle. So it's a course for anyone, but focused on healthcare professionals too. Can I have 30 more seconds just to show some of them? You know, of helping to explore. This is a sort of artwork piece that helps to tie the elements of the program together, representing sort of the complexity of food, how it connects people, to land, to culture, to art and beauty, trying to capture all of these things. So that these are fundamental to our well-being. And the course has different themes of expressing this individually and leads people through kind of exploring and learning and unlearning about the past history of indigenous foodways and the history of colonization, and then the importance and imperative to have a process of acknowledging that truth and finding a path towards reconciliation, from a white settler perspective, and particularly in healthcare. It's quite endemic that a lot of these things would never even be considered. It would just be your experience of the healthcare system is go in and have a Western science approach to building and contributing to your well-being. So for us in our work, I know you're going to talk about it later too, I'd seeing, but I think we're trying to embrace and walk in that kind of way. So I'll end there.
Thank you, Jen. Lindy, you are up whenever you're ready.
I am trying to figure out how to share my screen. Okay, I think I have it. Okay, so again, I'm gonna start this portion with talking about the lens in which I think food as medicine can be looked at, especially from where I sit as a professor who does research in this area, as someone who really works with communities and organizations to implement food as medicine strategies, interventions, and solutions. So I kind of want to frame it in, this is how it might be seen from one person's perspective, or largely a perspective, especially in the area in which I work. And then how I try to just describe it and broaden the perspective as I work with people who are doing food as medicine work, and the interventions and organizations that implement those interventions. So first, I want to come at it from one of the reasons I specifically entered into this work is wondering why Americans have a failing grade for diet quality. So this image is a representation of a grade that we give Americans based out of 100 for their diet quality score. And that diet quality is based on the American Dietary Guidelines. So Americans broadly across all ages, all age groups are failing in terms of their diet quality. And I wonder why, why is that happening? When we know there is such a strong link between diet quality and so many factors, whether that be obviously traditional health indicators like chronic disease, social factors, just quality of life, satisfaction with your life. Why is America, why when we think we know how to eat healthy, are we still failing at eating healthy, or following the right recommendations in terms of what we should be eating? And so this brings me into thinking about the very formal definition, or why in a very clinical setting, we think about food as medicine or food as medicine. I'm kind of using those terms interchangeably, but in terms of what we see more from a very clinical, very prescriptive definition of food as medicine, it's a spectrum of services and health interventions that recognize and respond to the critical link between nutrition and chronic illness. Again, a very specific definition of just that connection between our health outcomes, our individual health outcomes, and interventions that provide us nutritious food to address that. So this largely in this setting takes the form of medically tailored meals, medically tailored groceries, and produce prescription programs. And this is a very common image you might see again in these more clinical intervention settings, or maybe food as medicine groups. So this is already, wow, that time goes fast. Okay, I'm going to go through this quickly. But food as medicine, this is from the Food as Medicine Massachusetts Coalition, where they describe different methods from prevention to treatment of what food as medicine looks like. But like I said, I'm from Iowa, and I've always recognized the importance of agriculture in the what we eat. We cannot we cannot look at this problem, diet quality and inadequate access to food in a silo. We have to look at it in a system. And I think this is Jen, what you were really referring to. And this is, I'm not going to go through, obviously my time's already up. I'm not going to go through this entire model, but this is a model from the high level panel of experts from the United Nations Food and Agricultural Organization put this together in 2017. And I love this model because it shows you all the complexity that there is in our food system. And we can't just look at food as medicine again in a silo of we get people medically tailored foods, or we get people produce prescription programs. What are the other parts of the system that we need to recognize as being part of this food as medicine solution? Let me see here. Let's skip over this slide. And this brings me to thinking about how food is medicine. I think, Jen, what you were saying too is food is not only medicine to ourselves as individuals. Food is medicine to is medicine to our agriculture. Right? Food is medicine is relevant to our economy. Food as medicine is relevant to our social, cultural, and ethical capital. What we're talking about today. And this is a framework from the Academy of Nutrition and Dietetics they put together a few years ago, really looking at what we need for a sustainable, resilient, and healthy food and water system. And I love to present this because I think we really need to recognize all different parts of this framework in order to really implement a successful food as medicine solution, recognizing again our agriculture, our individual health, our economy, and then our social, cultural, and ethical capital as well. I'm just going to end with some images I'm part of the Iowa Food System Coalition, and these are some images from people doing this really important food system work, food as medicine work here in Iowa. Stop sharing if I can figure it out.
Amazing. That was so awesome. Let's open it up to the group. We have 5 minutes to talk amongst each other about all the rich things that were just shared. So any comments, questions, supports for one another, now's the time.
Well, thank you both for those presentations. They were really great. Hopefully we can share slides, and there's lots to dive in there. I'm really curious about it. I really thought the stance of I had never really thought of this deficiency of micronutrients, and the data that you shared of the pre-contact and current diet around magnesium and everything. It's just fascinating. I'm really curious how you how that intersects with you with the kind of I think there's some critiques of a dietetic pressure overly nutritional approach. This is one of the things that ends up being a thing that in our work as Nourish we struggle with, because the dietary guidelines, then menus get developed for that in patient food, and they become really somebody in the chain has to defend that, and that is healthy food and we must follow it. And then the idea of bringing in cultural food or wild foods or anything else becomes we get a real battleground. And so we often talk about not talking about nutrients, we want to talk about food. And I'm just curious kind of your take on that, because I think you are saying nutrients are food, and you're leading with something really interesting there. So
yeah, and I think it goes back to our ancestors. Everybody's ancestors had a diet rich in whole foods and not this processed food that requires scientific jargon to understand and define what it is. But that if you just simply think about a plate that a Coast Salish ancestor would be eating, or someone from Europe even, would have been rich in, a protein, wild leafy greens. Like right now, nettles and chickweed and dandelion greens are out. And those nettles are like 10 times more rich in calcium and iron than spinach is. It's just, so if you're like just one meal, and this is what I tell people. And actually there was a study that came out of Canada, where I can send it to you, but just eating one traditional food meal a week increased blood nutrient quality and content. So we know that that just one dose of this of foods that our ancestors have eaten for a very long time increases the nutrition quality in our week. So it is, it's also why a lot of people will report feeling like after they've eaten a traditional food, feeling really good. And I think it's part because we're starving for that nutrient, and it's so rich. You can't just like belly up to a whole entire slab of salmon. You're eating a portion size naturally because your body knows in its innate wisdom that you're hitting that max point. You don't need to, eat more like you would a bag of potato chips where you're just sort of eating and eating and eating. So it is, yeah. I don't, I don't know the answer. I try not to start with that unless I'm in, a group of professionals that are also my colleagues like you all that have also been thinking about vitamins and minerals and all the nutrients we need to stay healthy.
Amazing. Thank you.
Yeah. I really loved your poster series. The food is culture one that talks about foodways as a pathway to reconciliation and health. That is so spot on. It looks beautiful.
Oh, thank you. Yeah, I mean, this is obviously developed with so much input from really diverse leaders and thinkers, and an Indigenous artist worked with our graphic designer to design the whole thing. So I'm glad that it resonates for you. And yeah, it's very special. I feel like we were able to create together this learning journey and to be able to share it with other people. So
That's amazing.
There's 4 more. I can send them to you.
I would love to take a look at them. Yeah, definitely.
Yeah, I'd love your
I was gonna
feedback.
say drop a link in the chat, but then anyone watching
We'll be able to see it.
Yeah.
And Lindy, thank you for sharing the FAO. I think that the Food and Ag Org has such incredible resources. Like as a food geek, I'm constantly on that website, just looking around. So it's a great resource for people out there.
Yeah, and I thought your framing of bringing in the importance of the agriculture system as it is and how it will transition to this vision that we've all, I think, shaped up a little bit differently, but entries into that of like, how does it transition? How do we move something that is, driven a lot by the market? There is this other opportunity with, demands or shaping, the healthcare sector is quite a big part of the economy. So I think some of these things are very interesting to think about how, instead of having them fighting, can there be a synergy where these different elements that aren't often accounted for get included in how we find our path to sustainability and health. Yeah.
All right. Great. Let's move on to our next question, which is, I'll put it in the chat. How has the COVID-19 pandemic influenced the integration of food as medicine principles into your work? And Lindy, if you could kick us off for this one, that would be great.
Yeah, I think in a lot of ways, and you might hear this from the other panelists, is COVID-19 created a need for, or at least identified a need for greater resilience within our food system, period, right? At least here in Iowa, we saw a lot of movement that maybe we hadn't seen in a long time or been asking for in a long time around how do we get food to people in Iowa, and not just within the disrupted food supply chain. So we saw a lot of innovation around increased funding going towards local butchers, so that we can make sure that the meat that was, or the animals that were being raised to be butchered had a place to go to be butchered and then distributed out to people within Iowa. Other aspects like that. So there's really strong focus on local food. And then, of course, that's very much on the grower producer side of the food system. And then we saw this increased urgency for people accessing food, because food got so expensive, very hard to access. And so a lot in our charitable food organizations and the demand on them. And so I think thinking of, in my mind, what I saw is a lot of people from both of those sectors coming together um, during and after COVID to say, how do we find a path forward to make this connection better in the future? And again, have a more resilient food system that recognizes the importance of these growers and producers and the connection with people who need access to not just food, but nutritious food, right? And again, COVID-19 in a lot of ways expanded the way we think about also being resilient in terms of our health. So I think COVID-19 just opened a lot of doors in terms of new relationships, identifying new ways to partner, and then just awareness around a lot of these issues that people might not have seen that connection before.
Great. Thank you. Jen, you are next.
Yeah, I feel like all of those things happened. And in particular in the Canadian context, or in part of our work specifically with Nourish, we did have part of our response. We were then embedded within the McConnell Family Foundation and directed some grant dollars that we were able to access towards some food prescribing pilots that were just sort of like not off the cuff. Some of them were organizations that had either done some early piloting, but because we don't have federal or there's a few provincial programs that offer coupons for redemption at a farmer's market, but there's nothing really cohesive or funded in any kind of significant way. So it was kind of a wild period of experimentation and trying to meet the need. And I think, at the time I was looking back to in preparing for this of, a lot of the language we're using was this build back better. It's an opportunity of disruption. I think part of us all trying to stay positive in such a disruptive time of like, let's see it as the glass half full. We're going to try to build a better system. But I think when I reflect now, I don't know that I think it's raised a lot of these issues, but I don't know that it has galvanized action in a way that it hasn't pushed our systems to change enough. The systems didn't break enough, which is good because that would have been really bad for everybody, obviously. And there are immense pressures. And I think that still continue on economically and with inflation and, a number of things that are still the world coming back to the systems that were in place, still kind of recalibrating themselves. But I don't know that it really nudged us over the hump there. So I think there's a lot of potential for redesign of our systems and recentering. And I think unfortunately now we're kind of it's like the receding wave of these other pressures are actually preventing us from envisioning how we get to that new place. So I'm a little reading this question. I was like, I think I'm a bit of a black cloud or not feeling the most optimistic about what the pandemic has done or how it has I think we need to really stay focused on that and as a systems change organization, it's just a kind of question I think we need to come back to about how to be bold enough to not lose these wins or awareness. I think the awareness is much broader. So I would agree with you, Lindy, on that part. And now that's the work ahead of us, I guess, is to make the most of that for systems change. Yeah.
Thank you, Jen. And Valerie, whenever you're ready.
At the time and I know that you all probably, this life, but all of a sudden, like us food systems workers were also essential workers, right? I'm just having all these like flashbacks of what it was really like. And at the time I was working for the Native American Agriculture Fund, and part of my job there as a grants manager was to check in. I helped support a lot of food sovereignty projects across the country. And at the time, my boss was, her name's Jeannie Hip. She's an incredible ag lawyer and went on to work for the Biden administration as general counsel right out of COVID, and also had access to, conversations with the emergency relief programs and things like that. And we found out pretty quickly that Native people are actually not even written into those programs. So when it comes down to it, they legally, like at the time, didn't have to service us. But also what I was watching happening on the ground is that all these grassroots food sovereignty projects across the country, from Navajo Nation to the Mashpee, knew how to mobilize, knew what to do, knew they were the people that I could send, food donations to, and they would figure out how to distribute it. It wasn't necessarily local food distributors or even tribal governments that didn't have the infrastructure set up to receive and distribute foods to people who needed it. It was these grassroots, people who take like the tiniest amount of money and make amazing things happen out of it, that knew how to move quickly. And so I want to like make that point, but then also talk about the like incredible amount of polarizing that was happening between like what was right and what was wrong, and for what was the best way to approach this and support people, and what was the like totally wrong way. And that all of the answers always seem to be met in the middle, like right in the crux. And I hope that if anything, like Lindy, you touched on it so well, that it was undeniable, the cracks in our system. It didn't matter what socioeconomic status you came from, you were having a hard time getting meat and toilet paper anywhere in this country. And for some folks that I worked with, they were driving, the Navajo Nation, for example, would be driving 2 to 3 hours one way to get to a store with bare shelves. Along the way, learning that they'd been, their job was sequestered. So there was a lot of just sort of reckoning that happened. And I think that that music is hilarious. I can't get over it. I think that it helped us think about prioritizing a little bit differently. For those of us who have been working in these grassroots efforts for forever, it was like, we're ready because we've been preparing for this. And the strength was really tested. And that's also like where the sweet spot is in our food system. We have to lean into those people because they are the boots on the ground and they know how to get things done with little resources. And that's not cool, but it also is amazing that they can do that. They carry that wisdom and those connections. So the value is the people that are really doing this work and who feel that they've been born into it. It's like their birthright. They're not doing this to become zillionaires or famous. They're doing it because they believe that they've been put here to do it. And I think that's what it's going to take really to help our food system be stronger and healthier in the future, that we all feel that deep connection to food.
Great. Let's open it up to the group. I think you all said some very similar but very interesting and different things too. So very curious your questions and comments for one another.
Well, I just, I guess I have comments for both. I think, Jen, I don't think you're glass half empty. I think you're realistic in a lot of ways, right? And this is reflected in just something I read the other day talking about how do we actually change on the producer side? How do we actually make a change from commodity agriculture? And again, I'm thinking very specifically here in Iowa, right, where we are mostly corn and soybeans is what we grow. How do we change that? And it's not by continuing to maybe start or fund new, again, kind of going back to the butchery model, the animal raising model, is maybe it's not funding people who are starting it for the first time because maybe they'll crash and burn, right? They don't have the supports around them to sustain that over time, or the funding is not going to be able to sustain them. So how do we find ways to fund organizations that can sustain, that won't just be bought up by, again, commodity organizations or things like that? So I think you're very right. And I don't think you're thinking, I think you're thinking realistically about it, and we still need to be having these conversations, right? And then Val, I loved how you talked about the grassroots effort and all of the, I have so many stories about people like that in Iowa who just had forever been saying, well, why can't we do it that way? Why can't we do it that way? And got so many pushback in terms of there's these regulations and because of X or Y, and not unfounded, right? So a lot of it was around maybe food safety when I think about distributing food. Um, but those kind of got taken down during COVID-19 because we just needed to get people food. And it was a lot of those people who had always been saying, why do we have to do it that way? That's silly. We're denying people food. And they were able to do it then, and they were given the funds to do it, and man, did they soar.
I don't know why we can't just let them loose, and see what happens. It can't get any worse, right? That's how I feel about it. You're right. They had this like moment where they were almost empowered, like they were waiting for this moment to arrive, and we were getting things done. We're moving really quickly and getting things done. And I think the funding helped. But I also think the urgency helped. Like we were having a real reckoning at that point. So yes. I'm just really curious, like what was Canada like at the time? Like was there issues and hiccups with food distribution? Did it like international trade? I have so many assumptions about what was really going on. And I will say I had to work in Canada it was like 2021. So things were a little bit wind down, but crossing the border was such a big deal. Like I had to get the best test. And then they would call me every day for 10 days. And like I had to quarantine for 6 days. They would call me to make sure I was quarantined. They would make sure, like, they would ask if I needed anything. Did I need food? They asked me that. So I'm just really curious, like, why, what was it even like? I don't know if you can answer that in 90 seconds, but.
Yeah, I mean, I think a lot of the interdependency of our food system with the American system was very clear, and so the border closing was big impact for sure. There were, I don't think, I think similar pressure, the toilet paper and meat shortages were probably the clearest ones, but I do think there was a big a flowering of that, community aid networks. I don't know if they were as prevalent, and I think a lot were created from the need to respond. I find that fascinating that I think there was a really significant, similar to the US, like individual payments, supporting people financially, but then I think there were also these other ways that people had support for access to food and different things and shelter that they needed. Some regions of the country also closed themselves down. So I don't know if that happened in the US context, but my family live in Newfoundland and Labrador, so Ireland, in the North Atlantic, and similar to the eastern provinces, they just closed the provincial borders, and it was extremely hard where you had to have the quarantine time, and it was really not welcomed to travel around. Similar as your context, yeah.
Great. Our next question is similar, but instead of asking about COVID, I'd love to hear you all talk about how changing weather patterns in your region have influenced the integration of food as medicine principles into your work. We'll start with Val for this one.
This feels like something I'm grappling with, not just, I mean, I have been, but really thinking about like getting my chops together on it, because climate resilience is becoming such a big topic. It's like the volume is being turned up on it when it comes to food systems work right now specifically. I just recently wrote an article for Yes Magazine called The Old Growth Table, which really thinks about, it's considering the like old growth applies to forests, but that is also applicable to our foods, and that we have developed these relationships with foods that have been around for a very long time. Crabs, millions of years old. Oysters, very old. Roses, wild rose, and you can eat the rose hips, and that's a traditional fruit of ours. Well, globally, wherever roses grow. at least 100,000 years old. So we have these like old growth relationships with the foods that we've been consuming and building our bodies with for a tremendous amount of time. And now what we're seeing is, oh, and also with that comes these like wisdoms, right? Like lunar calendars. It's very, this is actually pretty new to us that we've been on this Gregorian solar system type of calendar. We've always globally organized our lives around lunar calendars, which includes entire moon cycles that are named after food that are part of that like time of the season that you would be harvesting, dog salmon or salal berries. We have a moon of the blackberries here in the Northwest. That means that our ancestors were organizing their lives around harvesting that thing during that period of time for a very long time. These moon creation stories go back to the Ice Age. And so for a long time, we've been doing this. And now what we're seeing are those moons, like when the harvesting time is shifting because weather patterns are shifting. We are seeing high mountain huckleberry, for example, in our region. The temperatures are changing at the high elevation levels so that now fruit flies can get access to those berries where they historically never have been able to get to. Sometimes wildfires are happening in our region where we also can't get access to berries because we have to drive, we can't drive through the fire to get to them. And oftentimes the road systems are compromised. Snow crabs are having a hard time. They're being completely diminished and can't repopulate. They're vanishing. Nobody knows where they went. And so that has something to do with the changing currents. Definitely like what's happening at the sea level is happening at a faster rate at the mountaintops. We're watching glaciers disappear in the Northwest region, which are named things like Mother Tahoma. For example, Mount Rainier is Tahoma is named Mother of Waters, which means if that goes away, like an entire ecosystem goes away with it. So definitely seeing some issues with weather patterns and being able to access our medicine.
Beautiful. Thank you so much for sharing. Lindy?
Well, this is a hard, I just feel like a hard topic, right? It's a very sad topic, hearing Val, you talk about all that and how beautiful a lot of that was, and then how sad I felt because of this topic. I definitely think changing weather patterns, climate change in general. I don't know if any of my principles, and I don't know if I've integrated it differently into the principles in which I work. I feel like for the most part, as I worked in this area, have always thought, as again, kind of as I talked about food being medicine, not only to our individual health, but also to our agriculture, our earth health as well. But I think I've thought more about how do I, from where I sit, very much more in the health side of things with my expertise, work to educate people in my area or where I live about how important changing weather patterns are to the food that we grow, and then how that impacts our health. So to me, it's been, how do I better educate people about climate change and making them aware it's not only important because obviously for all the reasons, but it's very important to our individual health in terms of what we eat. So that is, I guess, how I view this question.
Thank you. Jen?
Yeah, I mean, it is a hard one to get your head around, and to, again, finding the right tone and voice around it, around mourning it, and then also still feeling enough power that there is something that we can do and that it will happen in the right time frame, enough for it to really matter and add up. So I think in hearing stories from circumpolar regions in Canada, I think there is a strong or growing awareness of bigger shifts happening faster there. And, wildfires and all these other things. Like, I just think we're just seeing it so clearly. But then figuring out what we channel that into is sort of the thing in front of us. I'm very excited or interested in the direction that I do think health systems are starting to consider this. Like, so again, it's that food as medicine, I think, is like thinking at the highest level, like trying to think at scales beyond the current responsibility. Like, you administer a hospital, you're responsible to deliver healthcare services, but like thinking about what is that community that lives around, how are they being employed, what is their well-being, and what is the ecosystem that is supporting a watershed or a region. I think if you start thinking like that, you start to make very different decisions, or the way that healthcare service delivery, what it's considering, what is successful, or what is important to focus on, really can be broadened significantly. And I think that the food system, the regional food system energy of that direction, I think it's been growing for many years. It has a lot of strength, as we've all talked about. And I think that marrying itself with this shift in consciousness emerging from like health regions and thinking about planetary health and where the two intersect, I think that does offer some hope. But I think people get stuck a little bit in that, as you were saying, that question, Lindy, about like, how do you help the existing mainstream system transition? Because right now I've had more experience with it, but often it's like quite boutique and small. Local food systems are like, they're not really at scale. They cannot instantly replace the existing mainstream food system. So it is this kind of interesting question in front of us to think through. But I do think this overall net zero resilient healthcare frame is one that is really positive, I think, because it's going to open up a whole bunch of other people to take action in their daily work and in their strategic direction as organizations to help address climate change. Yeah.
Thank
I
you.
know that was a little off topic from your question, but
Oh,
going in another direction.
well, let's open it up. What do you all think?
Did I liked how you talked about this idea changing organizations' strategic planning or strategic visioning? Because if I don't know, it's again kind of going back to glass half full, glass half empty. Like, yes, if it can be done, that's great, but is it being done? I don't know. Then the pessimist in me kind of comes out. I'm like, is it being done in the right way or for the right reasons? And sometimes it's not, right? That's all part of like living in a system, especially in America, a very capitalist system. What are our goals, and are they different? But I think it is interesting. Yeah, can this be a part of strategic planning or strategic visions for a larger mass of people, or it is becoming, and what's the importance of that, and how do we capitalize on that, but at the same time have a realistic viewpoint of how does this not get, how trying to think of a nice way to say this, but how do the wrong intentions not come into play and take over that planning to make it something that really wasn't the initial goal, the initial outcome.
Yeah, well, to bring it back to the food as medicine frame, I think it is very interesting because I would, to overly simplify, like the food security or food sovereignty movements in Canada are really struggling with, or there's a big tension. But if you do anything that doesn't advocate for basic income or really systemic changes there, you're sucking away political power, and anything towards like a food support or something like food prescribing or medically tailored meals is like a distraction. And it's a very interesting challenge or like situation, because I think my experience in all of this is I often come back to the conclusion of it's both and. They're both needed. They both are that, the power of the healthcare sector as a driver for change economically is undeniable. And I think that's much more transparent in the US system. And I think, but it is a real challenge of like, how to not have it be just the business case. So, all the things that end up, they make a lot of sense and motivate people with a certain kind of responsibility for how do you make a good decision? What factors of risk are you going to take? So investing in food prescribing to reduce hospital readmissions or makes sense, but it needs to be more holistically framed. I think that's kind of our work, is always to be bringing that back in. It's not dollars and cents, it's communities and the planet, in the vision of trying to achieve it fully. But that's the dance, I guess, between those views. But I'm curious, Valerie, what you think, or you have other questions, thoughts?
So that's really interesting to me. I've been really thinking about regenerative ag. It's like a big conversation right now, and all organics is saying is like, we've already done that. This is organic. But what we're talking about is a system that is suffering from the effects of something that has really colonized it. And regenerating means it's going to take time to get there. Part of what our ancestors have always, again, globally, all of our ancestors have always done is like take that tradition with them, looking back, but also looking forward, making sure that, future generations can eat these foods as well. And so the answer is probably not going to happen like right now for the, like what you're talking about with the food sovereignty tension and the food prescription work. Like we do need both of that, and with the goal of getting to a place someday where it's regenerated, and that there is no more need for that status to be given, because we collectively understand the significance of food and how it impacts us, not just physically, but on all levels. And I forgot to mention, that's why I think it's really important to build into our models now how we're going to tell that story to the future, that we were here and that like Lindy and Jen cared and they were doing something about it. And this is the message that we have for you, because they're the ones that are going to ultimately be dealing with the bigger mess if we don't start changing now, which probably won't happen immediately. And also if we don't set them up to be able to like have the stamina to know how to think through these critical issues and be solution finders. I think that is the work that we can get done now.
That's beautiful. I love that story to the future.
Yeah, thank you. I think all of these conversations, oh, did you want to say something?
No.
Okay. All these conversations lead really well into our next question, which is Mi'kmaq elder Albert Marshall uses the term two-eyed seeing to conceptualize the coexistence of Indigenous and Western ways of knowing, and to recognize the strengths of these approaches individually and in combination. How do you each utilize this approach within your work as food as medicine? We will start with Jen.
Well, I should acknowledge that I'm currently living and working on the territories of Elder Marshall, the unceded territory of the Mi'kmaq, and as an located in the eastern part of the country, had the brunts of colonization earliest, and it's very interesting to be returning to this place. I lived here as a university student, and then I came back and started my family here, and then I lived 10 years in Quebec, and just came back in the summer. And I have to say that there's still so much work ahead, but the thriving of Mi'kmaq culture and its prominence, like it gives me a lot of hope, I guess, basically, to see the changes that have been made even in the short period of time from the process of the Truth and Reconciliation Commission in Canada and the call to action, which are, when they get assessed, there's still not enough progress and it's not enough pace, but it gives me a lot of hope, and it gives everyone in this country as citizens and leaders and really no excuse to not to not focus on that and have that be part of all of the work we are doing. So I feel like that is it's becoming a fabric of Canadian culture and identity. I mean, again, I don't think, it's not that simple, and there is political polarity. There are a lot of things in our country, obviously, that, it's not that simple. But so I think in the work I'm doing with Nourish, or our organization, this is part of our DNA of having a two-eyed seeing approach and grounding, and our work. So we have a board governance model, but we also have what is the Nourish Indigenous and Allies Advisory that has emerged from years of work and relationship building and leadership, that as we evolved our organization and grew our initiative from one person to two to now six, 7 people as staff, alongside we've had this guidance and leadership, and really invested in that. So it's like structurally in part of our organization, and I think it's possibly a model that other organizations and groups could use, and the kind of centering of this philosophy, and really having approaches to rebuilding and reconnecting communities. I think it's just a really powerful foundation for that. Yeah.
Thank you. Lindy?
So I think, yes. I guess I see this, or I'm trying to figure out the best way to talk. I feel it is so important, especially coming from a very, again, my background and a lot of the people maybe I've traditionally worked with think of things so science and evidence based, and not to say that this is one or the other, right? But sometimes we need to get out of our own heads in that way and see other perspectives, or not say that that is always the answer. Science is not always perfect, right? Um, or science in the way that it's so often thought about in our Western world. And so how do we do the best to step back from things being so black and white, in a very traditional sense? Like, we see things this way, so we can't see things that way. So just doing a better job of, yes, having different perspectives or acknowledging different perspectives. I'm just such an advocate for that in obviously this work, but I think just in life in general, being able to see others' perspectives, and recognize your own perspective on the issue too, is really important in this work.
Thank you. Val?
I would say that is sort of it's kind of the approach that I hope I'm taking in my work. We often think about indigenous cultures or our ancestors as being sort of stuck in some kind of conservative role, and actually our ancestors were always pretty innovative and always used the best of what was available at the time. The cultural values and the goals might have been different, and so that approach to how it was used might be different. But there's nothing more, I think there's, I don't know how to frame this, but the potential to get things done increases when we use both things. when we find a new way to move forward in the crux of an issue or a problem, or how we're approaching things. And when it comes to, to nutrition, I'm always like sort of searching for the messages that come along that are like, oh, that's what my ancestors meant. So for example, a tremendous amount of the Coast Salish diet included something called oolakins, or smelt fish, that were these really oily fish. And they return in smaller populations now, that we say like we could walk across the river on the backs of the salmon when they were returning because they were so abundant. But when the smelt would return, the fish or the rivers would look like they were boiling, like rain was falling from underneath. Um, and nowadays they're not as abundant and we don't get access to smelt as much, but we would render this oil from them that in our language would translate to something like liquid sunshine. And it turns out that oolican oil is incredibly high in vitamin D. And that is exactly what, you know, all Washingtonians have, is vitamin D deficiency, according to nutritionists. So there are these like overlaps of messages that are sort of, you know, sent through time and sent through our indigenous languages that validate Western science. And Western science can, because it's such a dominant view of the world nowadays, dominates or can validate indigenous science. Like we can use those things together and find a real empowered way of moving forward, where we're not talking about how different we are, but how we have, you know, understanding those two different languages so that we can validate what we know to be true and right, and what are also our needs. And so we need to take care of smeltfish so they can return to the rivers. Yes, that's my point. So.
Thank you. That was great. Let's open it up if you have any comments, questions, or supports for one another.
Well, just to pick up on that point, Valerie, of just the finding points of connection, I think, and what you shared too, Lindy, of I think a two-eyed seeing approach really just makes us all be learners. We're all can be curious, we can all explore, and we can see, you know, as you learn something, it gives you new questions. And I think it's just a really nice way to I don't know, frame an ability for people like in various different stages of comfort and experience. You know, if you've had the opportunity to be connected with an Indigenous community or learn about it or find, I think there's a lot of apprehension on the settler side of how to do that and to not make mistakes and to offend or to not know enough to even ask a question, have confidence to do that. So I do think it is one that yeah, it just kind of gives something very open and porous for, as you were saying, Valerie, resonated for me, of finding the ways to move forward together and keep our eyes on these bigger bigger issues that when we look at them too small, like the smelt, what is connected to that ecosystem rehabilitation that's required, it needs to be at a big high level, I think, in order for that to be regenerated, as you've been saying. Was speaking about earlier. So
Yes, I agree. And thank you for saying that. I know that it can be really difficult, and I want to note that it's by design. You know, it's not like we get a deep dive history lesson when it comes to Native communities or Indigenous groups. And so most people don't know how to interact, don't know if they're saying the right things or not, and don't know if the person that they're talking to is giving consent to, you know, take on that role in the conversation, which is why, you know, why we started Tahoma Peak Solutions, was to make sure to have those types of trainings offered to folks who want to be in good partnership with tribal communities as well. To be able to give them the right language to work with and time spent in that space, coming from a place of understanding that our education system did not teach this, and not from a place of, you know, harboring resentment or anything like that. Because again, with two-eyed seeing, we have to get somewhere, and it starts with really understanding where people are at, and not necessarily thinking that it's their fault, but that or that it's intentional, but that we all have to get through this and figure out a way forward. And I think that with two-eyed seeing, that's also like an interesting concept of not just looking, you know, these two different things, seemingly different things, but also looking again into the past and into the future, because that that brings us to a new place altogether, like a different center that helps us all find a unique commonality that quicker to get to the future. Back to the future.
All right, we can move on to our next question. So we've asked you all to define food and insurance access within Food is Medicine. What does that look like to you? And Val, we'll start with you for this one.
This is interesting to me. I feel like part of what treaty negotiation happened in as like the US was making this sort of land grab to, manifest destiny all the way to the Pacific Ocean, was these treaty negotiations, and within those negotiations came the access to foods or our cultural ways, and also education and healthcare. And not all treaties are necessarily the same, but the ones that the Stevens treaties, which represent Makata, Montana, are almost similar. Like there are little nuances here and there, but most of them are similar and include healthcare. And so to the best of my knowledge, there's only like 2 real socialized medicine systems in the US, and that would be the military, the DoD healthcare system, which I was raised in, and also the Indian Health Services. And that system is really held to an American standard, yet we are able to sort of define, how we want to receive those medicines. It's a very complex system. And so anyways, we have a lot of work to do in the Indian health system for many, many reasons. And I don't have 30 seconds to be able to describe it. But what we know is that if we had access to our traditional foods and medicines, we wouldn't have to be taxing so much on the Indian Health Services. And that is what people, by and large, really want. There have just been this historical severing of ties to that system, and in many different ways and through many different policies, it makes it really, really, really difficult for people to be able to just access their traditional foods and medicines. So if we had access to that, we wouldn't have to, lean into this insurance system. Casey, I have to say, your face every time it goes off is like the funniest part of the whole thing.
I'm trying to cancel it before it goes off, but sometimes I'm just too listening and it keeps happening.
Funny. Anyways, the insurance question feels complex to me, but I will say we need more culturally appropriate health care in this country, and not just for us, for everybody. Like what's good for us is actually good for everybody too. And that means more preventative care. I went to Paris last summer. My mom forgot her insulin, and we were able to just like get it like that. And when I talked to the pharmacist there, because I was just so taken aback, like she didn't have to do a major blood panel or anything to get access to it. They were like, we want you to have access to that because we don't want you to get sicker. We'll have to pay for it. So when our sickness is a business, it is always going to have issues. And we have got to stop making our sickness their business and start making our health our business. So I guess that's what I have to say.
Thank you. Jen?
Well, I think Valerie just said it. Yeah, I think again, I think this possibility, or like in the Canadian system, we would still have, we're like the US in that we have healthcare services are provided and then an insurer would pay. And in our model, there would be a federal contribution and then a provincial or territorial government contribution. And then First Nations healthcare service delivery is like it's separated. So it depends kind of where you're seeking care. So there's some complexity there. But I think what's missing in our system, and where I hope we could bring and accelerate change in Canada, is in that explicitness of what you just talked about. Of like right now, the problem is that food is not considered medicine, so it is not considered something that the healthcare system should cover a cost for because it's not, even though, you know, we have really strong data about the impact of food insecurity on people's health, and then therefore, you know, their health is the most important part, but then how they try to access or need to access the healthcare service system. So I think that's a like a leverage point for us possibly to make explicit. But again, the frame is so integral and important to be like keeping front and center the elements of how it will work as a program that rolls out. Like, how do we make sure that cultural food, and I think having models that are supporting community resilience and Indigenous food sovereignty, or food sovereignty generally, like how do we do it in a capitalist system and transition it to one that is a food sovereign food system for everybody, I think will be really important. And but I think some of the players in getting to this transition will be, you know, possibly private insurance. So in Canada, if you're employed, you typically will have a health benefits package, and some of those things, I think, you know, when you hear about what they're interested in, when they look at the bottom and, you know, the business model that they have, supporting people to be well and preventative is something that, again, a little bit risky to go too far down that road, but it is an opportunity for us to think about changing the business model that builds health. Yep.
Thank you. And Lindy.
Yeah, I think 2 minutes is not enough time to talk about this topic because we're talking about food access, which is an incredibly complex system within itself. And then we're talking about insurance access, which is also a incredibly complex system within itself. And the two, somehow these big systems never seem to like meet and talk to each other. And that has been so frustrating. Like with the produce prescription programs I work with, speaking clear, like specifically of the clinics, like they don't have time to slow down and do this work. And specifically, insurance companies want to see data that supports why these programs should be in place, right? They want to see, how is this affecting healthcare costs? What does it mean for, again, I feel like I'm always very pessimistic about this, but again, the reality is, how are we saving money by offering food as medicine programs through insurance? So healthcare clinics need to be constantly supporting and showing data about why this needs to be happening to provide to the insurance companies so that they provide funding for this. And then in terms of like the food access, we all know the issues within, and we've talked about within food access. So how do we kind of bridge those two areas? And again, I'm going to have so much more to talk about. And I think this is also a very political question to, again, thinking about how we talk about food access and how we talk about insurance costs as well. So I think I'm just going to stop because otherwise I'm going to go down a strange rabbit hole, and I'll end it with that.
All right, thank you. Well, we don't want this conversation to end here, so we're going to end our call with a call to action from each of you. So I would love to hear what you each want to see as next steps or actions in your specific work in food as medicine, or in your life or your field in general. And Lindy, we'll start with you for this one.
I think my call to action is for people to work better together to have these conversations again. Like, how do we get people who are working in food access to work closer with people who are working in health insurance, and working with, again, kind of to identify different perspectives in this. I know issues that we're having with our produce prescription program is access to the program itself. That might be because of like language barriers and things like that. So how do we make the programs themselves more accessible? But then also when we think about insurance coverage, is it going to be accessible for all audiences if it's going through private insurance, right? Like, who has private insurance? And then who has public insurance and who doesn't have insurance? So I guess my call to action is like, this needs to stay at the forefront of conversations that we're having. And I think we all need to come to the table, and we're all going to have our own opinions and our own goals and things like that. But how do we, I think to Val's point, like, how do we find those interconnections and those connection points where what I want is kind of also what you want, or, you know, and move forward to the best of our ability, in that way.
Thank you. Val, call to action?
There's so many. No, just joking. I think that it would serve us to, and I feel like I've said it over and over again, really in the last hour, just really take the best of what our ancestors left us and then try to be a good ancestor for those who are coming in the future. And when we can like move into these difficult spaces, all collectively thinking that way, I think we can get somewhere. And that's something that we all have in common. Like, we want to leave, humans have this desire to leave a legacy. We do, whether it's in written word or in stone somewhere, or children, grandchildren, lineage. We just want to like leave an impact. That's part of, I think, us trying to find our purpose and sense of belonging in this world, in this lifetime. And when we talk about food, it feels really easy to find that sense of belonging and purpose. And I think being able to open up that space for people, and also really think about how we're feeding the future, and not just like physically, but socially, emotionally, culturally, spiritually, all of the things. And food is such a great place to begin, because we rely on it. We need it to exist. And so why can't we animate that through what we're eating? And that to me is medicine, that, you know, that we become part of the living legacy that helps to support, like, a long line of a living legacy that helps to support people into the future.
And Jen, finish us off with your call to action.
Oh my gosh, it's hard to follow Valerie. I'll just what Valerie said and what Lindy said. Yeah, well, I guess, I need, in my role within Nourish, we do have the Food is Our Medicine online course. So if anyone is viewing this, I would really invite you to check that out. It's something you can go at your own pace, and there's varying levels of sort of journaling prompts and information, and it's really a rich set of resources, which I think, if some of these things that have been discussed today are of interest, I think that's a way to start to explore Indigenous foodways and learning about them, especially if you're from a settler background. I think for the future, I mean, I guess I'm just really trying to again, I don't know who will be watching this, but I think it's a promising time for like food system actors who I think have been siloed from climate and siloed from healthcare conversations. Yeah, as the other, two panelists have talked about, it is really critical that we make space and make time and approach these conversations openly to find our way to be building a healthier, more sustainable systems. And I think just something you brought up, Valerie, I wanted to resonated of like the stamina and the legacy and the ability to like enjoy ourselves while we're doing it and have delicious food and really find pleasure in this long and hard and difficult work, and find points of human connection where we can. Just something that I look to do more and not have so many desk lunches. So I'll just leave it there.
Beautiful. Thank you all so much for your time. This was an excellent conversation. And yeah, I really appreciate you all being here. Thank you.